Good morning and good evening, everyone. We're just waiting for a few more people to arrive and then we'll kick off.
Okay, I guess we can start now. Good morning, everyone. My name is Rawan Khouri. I am the Global Age Inclusion Specialist working with HelpAge International. I'm very pleased to welcome you all today to the launch webinar of the Gender Diversity and Inclusion Community of Practice. Let me take you through a quick look at our agenda today for this session. Next slide, please. Yes, we will begin with setting the stage, providing a background of the Gender Diversity and Inclusion Community of Practice, how it started and its importance. That will be followed by an introduction to the three thematic streams: gender equity and inclusion, disability inclusion, and age inclusion. We will then hear what the COP, the Community of Practice, have done so far, providing an overview of the survey results. After that, we will have an interactive Menti session. You will get the chance to answer some questions. Finally, we will wrap up with some next steps and how you could all engage with our community of practice. Before we begin, I'd just like to remind everyone that the webinar is going to be recorded. And with that, I guess I'm delighted to hand over to Caroline, who will take us through the first agenda item for today. Over to you, Caroline.
Thank you very much for the warm welcome. So, dear colleagues, friends, and partners, I welcome you and thank you for joining this important moment, the launch of the Global Shelter Cluster's Gender, Diversity and Inclusion Community of Practice. I'm truly pleased to open today's session and reaffirm our strong commitment to inclusive, accountable, and people-centered shelter and settlements response. This community practice marks a significant step forward. It builds on the dedicated work of many of you over the last couple of years, from thematics like disability and inclusion to gender-based violence, risk mitigation, and inclusion of older people. But this is not just a merger of streams. It's a platform for collective action, learning, and support, a space where we come together as practitioners to share knowledge, develop tools, and most importantly, challenge ourselves to do better. The community of practice, which launched in 2024 with the foundational support from CARE International, the Australian Red Cross, and UNHCR. And we are very proud to now welcome HelpAge International as a co-lead. Their leadership, along with their contribution of CBM and HI on disability and inclusion, are helping to shape a vibrant platform that reflects both operational reality and global commitments. The community of practice is structured around three work streams. The first one, gender equity and inclusion, recognizes that gender shapes access to shelter, protection, and recovery, and intersects with other identities to create a unique risk, especially for for women and girls. The second work stream is around inclusion of older people, acknowledging the reality that over 1 billion people globally are over 60, many of them living in risk-prone area and facing heightened barriers to access aid and participate to their recovery. And the third work stream is around disability and inclusion, grounded in the fact that 60% of the world, 1/6 of the world's population live with disability, a figure that is likely to be quite higher in humanitarian settings where risks are compounded and inclusion is still too often inconsistent and tokenistic. These streams are not siloed, they are deeply connected, and this community of practice provides a space to explore and address those intersections. We've already seen some of this work progress through the All Under One Roof guidance and hub on disability and inclusive shelter, the humanitarian and inclusion standard for older people and people with disability, and the efforts to link shelter programming with gender-based violence, risk mitigation, access to housing, land and property, and climate resilience. This work already responds to the reality we are already facing in the field. From Mozambique to Mali, from Yemen to Ukraine, clusters are adapting tools, embedding inclusion into HNOs and HRP, and piloting new ways of working. These are seeds we must continue to grow, and the community of practice is the ground to do that together. This community of practice is also a core mechanism to implement the Global Shelter Cluster's 2030 strategy, which calls on us to deliver shelter responses that are inclusive, accountable, and equitable. This strategy recognizes that safe and dignified shelter is a human right, but one that is not equally guaranteed. Through this community of practice, we are taking practical steps to make the right for people to access shelter more real. Let's make it clear, even as the humanitarian architecture is facing a reset, this community of practice and the work it represents will not disappear. Inclusion is not a passing priority.
Okay?
It's a pillar of good humanitarian response and will remain at the heart of the cluster's evolution. In closing, I'd like to thank you all for those who have helped to create and shape this community of practice, and all of those who are joining us today to shape its future. This is your space. Use it, challenge it, contribute to it, and let's make inclusion not just a principle we reference, but a reality we deliver. Let's all work together and make sure that no one is left behind in shelter and settlements response. Thank you very much. And on that note, I'd like to hand over to Jude for the next agenda item.
Hello, everyone, and good morning for many of you. This is Jude here with Yanina and Step from CARE. We will be your focal point for anything related to gender inclusion and equity stream throughout this COP, GDI COP. Don't worry, I'm not going to start with defining what is gender inclusion and how we do it, because I believe as shelter actors, you already know that if we are not gender equitable in our implementation or in our response, we risk failing the entire humanitarian system. So instead, I'm quickly gonna walk you through a few related resources, some alarming data, and real stories that bring all of this to life. Angel, I think you need to go. Yeah, next. So we are sharing here back Yeah, so we are sharing here a table with just a handful of documents and guidelines. You can find it online from published by CARE, IFRC, and IOM, and you can find many others with focus on gender responsive shelter and emergency program. It's also good to note that CARE is now updating its own gender and shelter program guidelines with a strong focus on intersectionality. That means it's not just about gender in isolation, but how it interacts with other identity factors. And your insights during this COP will really help us shape this guideline or this update. Next. What is reality we are responding to? So by data shows that by 2050, I know it's a long time, but around 1 million women and girls will be living in slums or informal settlements without access to basic services. Also, data shows that in disaster, women are in higher risk and higher mortality than others. And research in India ocean tsunami, after India's ocean tsunami, many women died simply because they weren't able to run away or escape. They were in their homes. And globally, around 30% of women own lands, only 30%, limiting their access to housing, recovery, and safety. Next, please. So what happens usually when shelter is inclusive? Programs that address trauma, caregiving, economic reintegration, and GBV risk reduce homelessness and improve mental health for women. Another study shows that for women and girls, a secure door, gender-segregated facilities, and lighting aren't optional, and they are essential for the safety of the shelter. In informal settlements, clean sanitation, safe walkway, and inclusive planning improve dramatically the physical and reproductive health of women. And finally, when women and gender diverse groups are involved in shelter design, outcome became more equitable and effective. Next. But are we doing enough? Unfortunately, no, because of the major funding cuts that happened recently. 50% of women-led aid organizations risk shutting down within 6 months. UN agencies are scaling back, reducing services for displaced women and children. In Afghanistan, NRC warning shows that almost half of the usually served people are going to be reached in the next year, and there is a huge gap. Most of them women and girls, and shelter program will shrink down. LGBTQ plus groups globally are under threat, putting inclusive shelter at even greater risk. So, yet hope remains, and the story from Isfania and Anjumasi are powerful reminders of us how fatal shelter is for people like them. So Yanina will tell us their stories now. Yanina?
Yeah, thanks, Jude. As Jude mentioned, we just wanted to highlight 2 case studies from the field just to bring what we're talking back to some real life examples. So this is Estefania, who me and my colleague interviewed a few months ago in the north of Mozambique, which is currently experiencing an insurgency, which is internally displacing people. And Estefania lives in a relocation site. She's the sole head of her household. She has 8 children. And Estefania is living in a transitional shelter, which CARE built last year. And as part of that programme, they trained committees of construction workers from the community to build shelters for their community. And Estefania volunteered. There was an aim of having a minimum of 50% women on the committees. And Estefania described to us how it was a challenging experience because women in general do not take part in construction in Mozambique. But ultimately, it helped her provide for her children. It gave her new skills, which she's using today. And there's this nice quote here that she felt that she was part of the solution for her community suffering. So I think this is a nice example of how shelter programs often integrate gender and women's empowerment into the participation process. Next slide, please. And then the next case study is an example of, well, really where we're failing women and girls in terms of shelter programming. So this is Anjuma, who I interviewed in Cox's Bazar in Bangladesh last year. This is a women and girls safe space that CARE have built in Camp 16, and it's one of Anjuma's only escapes and respites from her shelter, which is a standard Cox's Bazar, 2-room, bamboo, tarpaulin structure. And Anjuma described how there's a real lack of privacy and dignity for her in that space, but because of rising violence in the camp, she can't really leave the shelter very much. So I think this is a really good example of how a shelter can become a prison for women and girls if it doesn't cater to their specific needs. Next slide, please. So why do we need a gender equity stream if you're not already persuaded by those slides? So as Jude touched upon, really to bridge the gap and bring together what is happening in the field, what is being learnt, what opportunities are being missed, and technical guidance that's been written at a more global level. Ultimately to improve outcomes, particularly for women and girls, but then as a result for everybody actually. And to look at gender intersectionally, we really want to promote this idea that gender doesn't exist in a vacuum. It interacts with age, it interacts with displacement, disability. And we'd like to support the co-developing of monitoring and evaluation frameworks across organisations, across contexts that can be used. And then finally, on the back of that, promoting inclusive design so that looks at those intersectional needs of women and girls. Next slide, please. And we're here to support you. That's ultimately the point of the COP. We'll be sharing research, case studies, anything that you're seeing in the field. Jude already shared some resources, but we want to keep building that repository of tools, templates, easily accessible documents that you can go onto the COP website and just find. And through that support, local women-led partners, with technical monitoring, promoting their visibility, feedback, and then finally all of that to contribute to cluster coordination, advocacy at a global level, feeding into policy and influencing donors. So thank you very much. And I'll be passing on to, I believe it's the age inclusion stream next. Thank you.
Thanks, Janina. It's actually disability inclusion next. So I'll jump in, no problem. Thanks so much, Janina. I think that's really powerful. Hello, everyone, and thanks again for joining us here today. Some of you may know me from the previous Global Shelter Cluster Working Group on Disability Inclusion in Shelter and Settlement. But for those who don't, I'm Leanne Marshall and I work with Australian Red Cross. I'm really excited to be able to say that we're continuing on in this community of practice, some work around disability inclusion from that previous working group, because I really believe that the shelter sector can play a huge role in improving disability inclusion more generally across the humanitarian sector. So why do we think it's important? I mean, we're all starting with a few of these sort of big statistics. And as Caroline mentioned right there at the beginning, globally, around 16% of the population, which is about 1.3 billion people, experience significant disability. And up to 80% of those are in low and middle income countries where humanitarian crises, as you know, hit hardest. This percentage is pretty consistent in humanitarian settings, but individuals with disabilities often face compounded vulnerabilities, and that's partly what we're trying to talk about within this COP with all the different streams. And people can face up to 2 to 4 times higher risk of death or severe harm compared to others. Recent research also suggests that around 25%, only around 25% can navigate evacuation processes independently, and only about 11% are aware of disaster plans. Just back on the first one there, Angel, please, on the statistics. So yeah, as Janina has already touched on, you know, when we consider gender and also Rowan will talk about with age, these vulnerabilities are magnified when we talk about those compounding, those compounding personalities, compounding issues. So, and really, I think we've got a slide here with a lot of different figures on it, but they're not abstract figures. Like, these are lives at risk every time a cyclone approaches and war breaks out. So we have so many examples that we could share. And you know, this is as such, you know, something as simple that probably everyone is aware of, like so many people who are unable to access distribution sites or services due to mobility impairment. We have many stories of such as a woman in Cox's Bazar who was deaf and had low vision, so she missed critical safety information to relocate during a flood. All of these things are really important for us as shelter practitioners to be aware of to ensure that our programming at every stage is inclusive. So it's really about taking those numbers and making it practical for everyone. And that's why we want to continue the disability inclusion stream in this COP. Next slide, please. I just wanted to quickly touch on what the cluster has done to date around disability inclusion. And as I mentioned, from 2018 to 24, we had the working group, and this group created space for that learning and practice, learning about good practice and identifying where support was needed. One of the things that we did first in that group was undertake a baseline mapping, which you may be aware of. And this was a mapping across the sector to understand how we were tracking. That gave us a bit more information around the gaps around shelter programming and response, and that built on some of those global statistics I mentioned in the earlier slide. It identified, for example, that disability inclusion is widely acknowledged in the shelter sector, but it's kind of poorly implemented in practice. It also showed that shelter actions can sometimes be too focused on physical accessibility, ignoring other disability dimensions, and that also data collection was not leveraged for better accountability. Some of this is improving, and some people on the call that I've seen can attest to that. I saw that Sue Webb, for example, was online, has done a lot of work on mental health and shelter. And I think it's really important that things have moved on since the baseline mapping, but we still have a long way to go in disability inclusion, which is why we think it's really important to keep this stream. A lot of the findings from the baseline mapping directly informed one of the other main activities of the working group, which is the updating of the All Under One Roof Disability Inclusive Shelter and Settlements and Emergencies Guidance and Training Package. So we did that in a collaborative way. I'll see if I can put that in the chat now, because we actually created a hub, which I was put on the screen now, where you can find the guidance, you can find case studies, and you can find other information and links. I'll put the chat there, around how we can improve our work in disability inclusion. And we have a few case studies similar to what Janina was sharing just before, but we want to have more. So partly what we want to hear from you through the COP is more case studies, more examples of how this is working in practice. And I also encourage you to access this continued hub, which will continue with the COP, to access those resources going forward. So just on my final slide from me is, so yes, now that the working group is going into the community of practice, we do want to continue supporting you in all the ways that you want to be supported, but these are a few things that we thought we can continue to do. So we will continue to help with ongoing updates in additions to that All Under One Roof hub, which hopefully will have more case studies, but also guidance and training and other learning. And we will commit to sharing capacity strengthening opportunities where relevant and provide connection to regional platforms. But one of the most exciting things for me in the disability inclusion stream is that we can provide technical support from disability inclusion experts, both HI and CBM. So we're extremely grateful that these two organisations have committed to providing this support. And I'd like to hand now over to Nicholas Wynn from HI, who will talk a little bit more about what his organisation can offer in particular. Thank you, Nick.
Thank you, Leah. Good morning, good afternoon, and good evening to everyone. My name is Nick Wynn, and I am the Global Shelter and NFI Specialist for Humanitarian Inclusion. And I will speak extremely slowly because I have a tendency to speak far too quickly. So yes, from my side, I'm very lucky to be asked to help on this community of practice. Yeah, I'll speak for a couple of minutes. So how can HI support everyone with regards disability inclusion, specifically within shelter and NFI programming? Well, HI has a substantial experience in developing key guidance in collaboration with many of the people on this call and independently. And these have led to several key guidance documents that people can see on the screen now. Angel, if you click the button just to bring up the icon kind of image. And this, though, is the kind of unplanned consequence of all the guidance that we produce. It becomes overwhelming, and we are now in a stage of sectorial movement, shall we say, where we have to be more efficient and more effective with less. And hopefully we can help support and be a resource for everyone. Translating this often mass library that we have of guidance is often time consuming and challenging. And in a recent Francophone survey, one of the challenges that field teams found was kind of this move from theory to field. And I think this is where we really can help support partners. And we'd like to help bridge this gap between guidance and real world application. So making implementation more accessible and effective. And so what we can see here is quite often in the sector, we like to reinvent the wheel, which unfortunately is quite found to be inefficient and ineffective. But the byproduct is that we continue to develop this kind of learning tree, this guidance tree. And hopefully by having kind of a centralized kind of technical support, we can HI can be a conduit to supporting field level implementations. So the idea is not to reinvent the wheel, but to make it easier to find the most appropriate wheel. The support that we'll be able to provide is across all phases. So the design, the implementation, review and research. And also we're more than happy to provide training to field teams, but also to support in field teams developing their own training for their organization. We've mentioned that there is some case studies available on the All Under One Roof hub. However, I think one of the areas that we don't do as a sector enough is to publicize the good work and the learning that we do all kind of face in our day-to-day jobs. And I'm hoping to work with partners to kind of draw this out and develop more case studies, and wherever partners feel a need and a willingness to publicize their work, then I'm more than happy to help. And lastly, I think how I will be doing this is that we'll be responsive, accessible, and we will be driven by shared learning. I will be handing over to Rowan, and I hope to meet many of you in the coming weeks and months. And thank you for your time.
Thank you, Nicholas. Thank you, Jude, and thank you, colleagues, I think you've mentioned a lot of the things that I'm going to mention today. I think we are the newest member to the COP, and I'm very happy that older people are getting the visibility that they deserve. I think foremost, we need to highlight that the populations are getting older, and we are experiencing global population aging. And as you can see in front of you, from the year 2015 till the year 2050, the percentage of older people aged 60 and above is going to increase from 12.2% to around 22%. And this is a huge increase. Can you press the button, please, Angel, for the, yes, the other. If you take a look at these figures, it highlights the population structure in less developed regions, comparing the years 2005 and 2050. And I think you can notice by looking at this graph that the larger age groups are going to increase massively by the year 2050 and going further throughout the years. And projections show that by 2050, more than 80% of the world's older people will be living in low and middle income countries. Next slide, please. I think my colleagues previously did touch upon the intersectionality and how important it is not to look at each factor in its siloed approach, but rather looking at them in an intersectional approach. If you just take a look at these figures, 46% of older people have one or more disability, and this is a huge percentage. And also you notice another figure that more than 25% of the world's women are over 50 years old. And this makes us think that we actually need to start thinking about including older women in our responses and in our programs. Next. Here I'd like to focus more on the work of HelpAge International. One of its strategic objectives of influencing the humanitarian system to be more inclusive of older people in all their diversities, as we previously mentioned. The age inclusion specialists up to this date, actually, we have one global age inclusion specialist and 8 who are spread around in different contexts. They are currently embedded in different coordination groups, mostly under the protection cluster, because that's where age and disability working groups usually sit. But we are actually thinking of widening the scope of age inclusion specialists wider than the protection sector to cover multiple sectors across the humanitarian sphere. Next slide, please. Actually, it's important because this is the type of support that you will be receiving from the specialists. So it's good just to highlight what specialists do. They are actual vital resources on older age inclusion because they get trained, they get coached, and so they have the knowledge and expertise to enable them to actually provide the training, provide technical, thematic advice on aging, on protection, on inclusion of older people. And we have a very strong, I think, component that we actually need to focus on, especially in current days right now, and we're moving through the localized agenda, is to actually support the meaningful participation of older groups and their representative organizations. OPAs here stands for Older People Associations. And I think it's very important to encourage their participation, to help them raise their voices, to remove the barriers that limit their participation, because again, this is in line with our AAP commitments and around all the person-centered approaches that we always talk about. They also promote, they have a very strong advocacy component, right? So they promote the use of sex, age, and disability disaggregated data, not only collection, but also the analysis of data to identify needs, to identify capacities, to be able to respond better. They do work with other clusters, and I will show an example of this just shortly. And finally, they also work with humanitarian organizations to improve their organizational programming through working with them by having an age and disability organizational assessment. Next slide, please. This is the final slide, and I think this is the most important. And I think my colleagues have already touched on the support that we will be able to provide. And I think looking back at what Jude, my colleague, mentioned about the resources, I think, yes, we will also include many resources within the COPS page that will help you navigate your work. But again, we also are happy to provide capacity strengthening initiatives, because I know that aging is a new topic, older people is a new topic, and you might need support in navigating your way around that. We can provide technical advisory support. And again, as my colleagues mentioned, sharing research, assessments, documents, and learnings from different contexts. And here I would like to point from a country context. For example, in Ethiopia, they have recently developed an age and disability inclusive shelter and NFI guidelines in Ethiopia, and they requested our age inclusion specialist in Ethiopia to support in developing this guideline to make it inclusive of older people. There is another guidance, which is the Humanitarian Inclusion Standards for Older People and Persons with Disabilities. This is an important global standard for us. It includes 9 key inclusion standards, but also includes 7 sector-specific standards, and one of them is about shelter settlements. And you will find key actions, guidance notes, case studies that will also help you throughout your work. I think finally there's a guidance here on including older people on emergency shelter programs. HelpAge has worked on this guidance in 2012, but I think it's time for us to update this guidance. And we have thought, we've discussed this with Leanne previously, and we have thought of actually updating this guidance under the community of practice. And I wanted actually to ask you if you are interested to get in touch with us, if you wish to get involved in the process, because we do want it to make it participatory as much as possible and operational as much as possible as well. And with that, I think, yes, I'll be very anxious to hear back from you, from whoever is interested. Thank you for your time and attention. And now I guess I will pass back to Leanne, who will highlight what the COP has done to date. Over to you. Thank you.
Thank you so much, Fran. And yes, very much encouraging everyone to get in touch if you're interested in helping us to undertake that updating of the guidance. I know that a lot of people who are on this call were engaged in the updating of the All Under One Roof Disability Inclusive Guidance. So it's really great to work with you again on that kind of activity. So I will quickly go through a bit of what we've been doing to date. So of course, because we're bringing together a number of different strands and different technical streams, just on the first one, Angel, if we can just stay there for a second, because I just want to show everyone this website, and I'm also going to put the link in the chat here again, so that everyone can go and follow on the Global Shelter Cluster website, the Gender Diversity and Inclusion Community of Practice. And you can see down in the bottom of that left-hand of that screen, you can see that each of the themes that are talking today have a different page, and that's where you will be able to find contacts for the people to be in touch with for support in any of the streams, and that's where we'll also share some of the resources. The resources will also be on the broader page, but I really encourage everyone to go to that webpage on the Global Shelter Cluster website and see where we're going, and also let us know if there's anything else that you want to include there. The next slide. So while we were confirming the streams themselves and coordinating that support, one of the activities that UNHCR Care and Australian Red Cross worked together on before HelpAge joined was a quick survey last year to get a snapshot of how well gender and disability inclusion are being integrated into shelter cluster coordination. So we looked at internal representation, partnerships with relevant organisation, and the kinds of challenges that clusters are facing. We had participation from 15 global country level shelter clusters. So that gave us a good sense of current practice and gaps to inform us as we move forward in defining some of the activities and priorities of this COP. Encouragingly, if we're looking at gender representation as a starting point, all of the cluster reporting had at least one clusters reporting had at least one female staff member, but women still only make up about 30% of total staff. So that's interesting. And then, despite that, there are 11 clusters that had women in coordination leadership roles, which suggests that we're seeing some meaningful representation. So next one, please, Angel. If we're moving on to external partnership with women-led and women's rights organisation, there was also encouraging results here. 9 out of 15 clusters reported having partnerships with these types of organisations, and these weren't just token. I mean, 5 of the clusters had WLOs or WROs represented in strategic spaces like the SAG or technical working groups, and they were also actively participating in multiple cluster activities. In terms of internal coordination, 9 clusters had a focal point for gender or GBV or PSCA or other protection mainstreaming, and 8 clusters also had someone representing them at interagency coordination spaces such as the GHA. So my key takeaway from that is that engagement is pretty practical and visible in most of the clusters around women-led or women's rights organisations. Next slide. Things start to look a little bit different with partnerships with organisations of persons with disabilities. Only 3 clusters reported formal partnerships with OPDs, and only 1 had an open in a SAG. So that's quite different. Some clusters engaged directly with OPDs, but mostly engagement happened indirectly through a separate working group or via the protection cluster rather than through shelter mechanisms themselves. Clusters talked a lot about their challenges. Many found it difficult to identify relevant OPDs or lacked funding and staff time to engage. And some also noted that OPDs themselves weren't interested in joining shelter cluster activities sometimes, preferring to work directly with the protection cluster. So I think that's super interesting. And for me, the key takeaway is that while there's awareness of disability inclusion, the actual engagement with OPDs remains pretty limited, which is a major gap and one that we hope to help address through the disability inclusion stream, as Nick and myself mentioned earlier. Next stream. Next one, sorry, Angel. Next one we looked at was around data and monitoring. And that's looking okay too. We saw that 12 out of 15 clusters reported that they are disaggregating needs assessment data by sex, age and disability. A lot are including gender and disability questions in tools, but there's less so with GBV risk. And when it came to consultations, most clusters are engaging with key groups, so women, girls, children, youth, and persons with disabilities. Only 3 clusters reported not doing any of that engagement at all, but that's still not a great sign. Importantly, disaggregation engagement carried through partially into monitoring frameworks. And so 11 clusters said that they continue to disaggregate data. And I guess overall, again, my takeaway from that is that we're seeing some good practices here. Let's go back on the other one, but where that depth and consistency still varies, especially when it comes to capturing risks like GBV. This final, if we're talking about challenges in trying to incorporate inclusion, none of these will be new to anyone on this call. If you're interested in inclusion work, obviously, people talked a lot about a lack of resources, insufficient time, lack of accountability mechanisms because there's no accountability mechanisms, it's deprioritized, there's competing priorities, and often there's sensitivity around issues like GBV risk mitigation. And that can make these conversations a bit more difficult, particularly in certain cultural contexts. So I guess, I guess there's also a lot in that lack of expertise and information. And this is where we would like to be able to support as the COP. Things around the complexity of being able to address everything at once, but also insufficient capacity or technical expertise to do that addressing and to integrate issues. And also just lack of technical guidance and tools and limited targeted support. And that's where we want to kind of focus a lot of our efforts. And limited data and information is very common. It's not all bad though. One of the things that was said is that focal points can be an enabler and help to sort of smooth and include to improve that coordination inclusion journey. Next one, final one. I'm not actually going to talk about this at all because I've overwhelmed you with a lot of information from this survey, but I'm just including it here so you can see, and when you can read it after this call, to see that there's lots of examples of positive things happening. And really we're seeing progress in many areas, especially around engagement with women-led organisations and data disaggregation, but still a long way to go when it comes to disability inclusion, for example, also consistent monitoring and resourcing cross-cutting work. So these findings, and I know it's been really quick, but these findings are really helping us to shape how we build out the support streams in this community of practice. But we also want to hear from you because this is a survey we did last year, but we want to see what people are thinking now, especially because we have the age inclusion stream now. So I'm going to hand over to Angel now to launch a very quick Mentimeter poll, and then we will be able to go through those questions, and then there'll be a little bit of space for discussion questions after. Thanks so much.
Hello, everyone. So thank you very much for joining. So now we will ask you a couple of questions just to understand what you want from us and how we can help you. So just we will pass on if you can perhaps scan this QR code to answer through your phone, or alternative, go to menti.com and use the code 19608797. So I'll move the slide also here for you to see. It includes the same QR code. So you can have as well menti.com and 1960-8797. So the first question is, what kind of support would be most useful for you from this community of practice? You can vote in several of them. And if you say other, we will allow you next to be able to answer that. Okay, so we have there at the top, peer learning and sharing, 8 of you, then 9. Okay, let's give it one more minute to give a few answers. Okay, so peer learning and sharing seems like kind of the top priority of the COP for you, followed by webinars and events. I'm sure that with the thematic topics that you choose and that become relevant, we will continue to provide webinars on technical specific issues, then technical guidance and advice, resource sharing, then followed by advocacy support. Okay, so then with this, we'll move to the next one for those of you who have clicked other. So we give you the opportunity to kind of put it in the chat. So what kind of support would be most useful for you from this? If you have other, something additional to what we had in the screen before. Besides peer learning, besides technical guidance, webinars, sharing resources, advocacy. What else? So 3 of you said others, so we expect, okay, so job opportunities in the sector, that's great. I mean, actually, that's something that we can do through the community of practice if we are aware of professional opportunities within the sector to share it. So I think that's feasible. We do that within the shelter cluster anyhow for our partners. Okay, raising awareness among senior leadership on these issues. So okay, that's part of advocacy, but more on internal leadership issues. Advice on finding funding. Okay, so fundraising for specific issues related to diversity and inclusion and age and gender definitely can be included. Stakeholder engagement strategies. Okay, so that's kind of an interesting one. Trainings and funding to deliver the message at local or national levels. Okay, well, it's lots of inputs now. Technical advice for ensuring appropriate mainstreaming, gender, diversity, and inclusion. Policy advocacy and stakeholders engagement. Okay, so there's a couple of duplicates here. And I think with this, maybe we can move to the last question. We will take note of this, by the way, and we will make sure that we answer those in the coming sessions. Okay, real-world examples, field-tested tools, expert-backed guidance, peer-led learning, push-driven resources such as toolkits, and pull mechanisms like an expert help desk and forums. I think, as the previous colleagues had explained, part of the community of practice is to be there to kind of guide you and support you. So you will have the contacts or all of the 3 lines of work that we will have within the community of practice. And if you have, just a question or something like that, you can write to us and we will be happy to answer. So then, are there any specific topics or themes you would like this community of practice to focus in the next 6 to 12 months? So what are your priorities within gender diversity and inclusion? I'm sure that Leanne will mention later, but I think we are looking to have at least a webinar every 3 to 4 months. So of course we will always try to kind of get from you what priorities you have to make sure that the webinars are related to the topics that are most important to you. Okay, including vulnerable groups in decision making. Okay.
Another point to make as people are thinking
Yes.
about this is that we are also looking to add to the streams as we go forward. So we're in conversations with groups that are looking at LGBTQI plus inclusion, and we're open to having conversations with you about other inclusion areas that you'd like us to focus on. Thanks.
Thanks, Leanne. So we have another one here, disability inclusive shelter mapping, urban displacement and gender diversity and inclusion considerations, navigating resistance to inclusion in conservative context, cash for shelter with a gender and diversity lens. Okay, we'll have to look at this one in more detail. Regular webinars and workshops focus on best practice in different contexts. Okay. Good. Practical field training for teams on the ground. Age inclusion, this is a huge gap at the moment. Government systems strengthening on GDSI and DRR. Good. What else? Joint advocacy on the importance of the topic. Good. I mean, as part of the wider Global Shelter Cluster, we do advocacy work, so we are happy to work with the different communities of practice to make sure that, you know, we do advocacy on very specific thematic topics as well. Intersectionality, good. And I don't know if besides any of the topics written in the screen, if anybody wants to say something verbally, please unmute yourself and you know, happy to hear what you have to say. So how to reach hard to reach households where they are PWD and other older people. Okay, joint advocacy on the importance of the topic. Okay. If nothing else, maybe we can move next.
Yeah, it'd be good to know if there's just any quick questions before we move into the final bit of how the COP will work, or how you would like, or even just a comment on how it will work. We'll just give a minute or so.
Yeah. So anybody wants to say anything verbally? No. Okay, so Leanne, I guess back to you.
No, it's with Janina. Thanks.
Okay.
Yeah, so we're almost at time. So, well, first of all, thank you so much for everyone for attending the launch. It's been quick, but hopefully informative and not too overwhelming. And we already mentioned this, but there is going to be a webinar in the next 4 months, and the first one will be focusing on age inclusion, so our newest member of the COP, so that's exciting. And we please continue to share any challenges, and like Leanne mentioned, we're looking to add to the work streams, so any focuses that you want to see reflected in the COP, that's what we're there for. We'll be reviewing the Menti results in a bit more depth and providing feedback as well. Next slide, please. And yeah, in terms of engaging, continuing to follow us, so it's already been shared in the chat, I think, but you can find us, you can find everything we're doing on the website at the Global Shelter Cluster. And you can access on there the 3 different streams. As we mentioned, we're building a repository of resources in each of the streams and across the streams, because we've talked a lot about intersectionality today. We also have an email that's there as well. And you can see there's a QR code there. So probably one of the quickest and easiest ways to follow what's happening is via the WhatsApp group, where we'll be sharing updates of the next webinars, topics, themes, links. And yeah, please do get in touch, get involved with anything you want to see reflected in what we do next. And just a big thank you again for attending. Yeah. That's it. Thank you very, very much.
Thanks so much all. And
Thank
honestly,
you.
if anyone has any very quick last comments, feel free to make them before we wrap up. Oh, great point around the role of caregivers, family, and practical conclusions we need to take to support their inclusion. Very, very appreciated. I think that was Sally. Thanks very much. And yes, thanks everyone for joining. We're looking forward to engaging with you ongoing.
Bye-bye.
Thank you so much. Have a great week, everyone.
Thank you, everyone.
Thank you, everyone.
Thank
See
you.
you.
Thanks so
Thank you.
much.
Bye-bye.
Thank you. Bye.
Thank you. Bye-bye.
Thank you.